Welcome, everybody. On behalf of the National Center on Afterschool and Summer Enrichment, NCASE, I'd like to welcome you to today's webinar on addressing adverse childhood experiences in out-of-school time. NCASE is part of the Administration for Children and Families Training and Technical Assistance System, which supports state, territories, and tribes in implementing the Child Care and Development Fund, or CCDF. CCDF provides subsidies to help low-income working families paid for child care. And I'm Siobhan Braden. I'll be your facilitator for today. I'd like to welcome our other presenters. Joining me from NCASE is our project director, Katari Coleman. We're also pleased to have Heidi Ham of the National Afterschool Association joining us, along with Jennifer Drake Croft from the Tennessee Commission on Children and Youth. A lot of the information that we'll be sharing today is from a recently published research brief that's available on the Child Care Training and Technical Assistance website, and you can see the link there. We'll also be providing it in the deck, which you can download in the file share pod. And I'd like to invite Heidi Ham, who's our co-host for today's webinar from the National Afterschool Association, to share a few remarks. Heidi brings a lot of experience in out-of-school time. She's a product of out-of-school time programs. She's a longtime member and supporter of the National Afterschool Association and a participant in national youth work. Heidi?
Yeah, thanks, Siobhan, and so great to see these photos of this is the first time I'm seeing this slide, so thanks for sharing the slide of our next generation after-school leaders, and then this photo of folks from our recent convention. It's great to see those smiling faces, so thank you for that. Hey, everyone, the National Afterschool Association is pleased and very excited to co-host today's webinar and share the accompanying research brief on addressing adverse childhood experiences with you and the rest of the folks in the out-of-school time field. For those of you who don't know, the National Afterschool Association is the National Professional Membership Association for people who work with and on behalf of youth during out-of-school time. We contribute to young people's success by supporting, developing, and advocating for after-school professionals and leaders. We know that the information being shared today is crucial to our work and to yours. Out-of-school time programs and the professionals who run them have we've long supported social and emotional learning and the research on school-age children's development, the impact that ACEs can have on that development, along with mitigation strategies, will assist our members to best understand and support children and families. In addition, we have 32 state affiliates, and it's great to see some of those names being introduced in the chat box. Our state affiliates promote quality after-school programs and professional development at the state level, and we hope that they'll be able to use this brief and the recorded webinar to inform their networks of the prevalence of ACEs and concepts to support the development of mitigation and prevention strategies. So thank you for joining us today. We look forward to it.
Thank you so much, Heidi, and we really appreciate NAA's co-hosting this webinar with us today and sharing the brief with your affiliates and members. Our objectives for today's session are to increase understanding of the impact of adverse childhood experiences on school-age children. One of the reasons that we're very excited about today's webinar and the brief is that it does focus specifically on school-age children and school-age development. We're also going to explore mitigation strategies and approaches, and we're going to share some promising practices. Our colleague from Tennessee is going to share some promising practices implemented in her state, and then we'd also love to hear from you about promising practices that you're implementing in your state, territory, tribe, or program. So our agenda is quick overview of school-age development, focusing on, then we'll focus on ACEs in school age. We'll talk about some strategies, and then we'll hear from our Tennessee presenter who will share the Building Strong Brains initiative. But now we'd like to hear from you. We're going to do a poll, And the question is, do you support the needs of families and school-age children affected by ACEs in your work? And the answers are yes, no, not sure, because you may be very familiar with adverse childhood experiences, or this might be somewhat new to you. So we'd love to just do a quick poll on that, and then we'll dive right in to our presentation. Okay, so the majority of folks right now, 84.5%, say yes. Less than 3% say no, and 11 to 12% say that you're not sure. So thank you. And now I'll pass it over to my NCASE colleague, Katari Coleman, who brings extensive experience with ACEs at the state level and who also authored the research brief. Katari?
Thank you. As Siobhan stated, I am Katari Coleman, Project Director of the National Center on Afterschool and Summer Enrichment, better known as NCASE, and I am so excited for this opportunity to share this incredibly important information with you today. So let's get started. Let's put this in a developmental context. I don't know about you, but when I envision development during this span, it is tremendous. Think of a 5-year-old you know, then a child about to turn 13. Wow, it's expansive and complex. So school-age development encompasses the latter part of early childhood from 5 to 9, and then adolescence from 10 to 13. Physical development is steady. This is seen in their overall appearance and physical abilities, especially in the preteen years with visual, gender-based bodily changes. And cognitively, due to natural progression in academic expectations, we notice a shift from concrete to abstract thought. Moving on to school-age brain development. From conception to age 5, about 90% of brain development occurs. While structures and neural pathways have been established, the school-ager's brain undergoes continuous wiring and pruning, with connections becoming more stable. Remember, at this time, cognitive skills, motivated by academic tasks, undergo transformation and enhancement. Skills like understanding and decoding language move to understanding, retaining, and writing it. And let's not forget about the refinement of abilities like impulse control, judgment, and following social rules, all tremendous work of the incredible brain. So school-age social and emotional development. As you see here, CASEL, which stands for the Collaborative for Academic, Social, and Emotional Learning, details school-age social and emotional development by 5 strands: self-awareness, self-management, social awareness, responsible decision-making, relationship skills. The school-ager's development moves from a self-centered perspective to a concern for others as they become more self-aware and gain control of their emotional state. For example, under the strand of responsible decision-making, a child moves from it being difficult to wait, think, or plan to an acknowledgement of moral responsibility and the concept of fairness to an ability to do abstract reasoning. This allows them to be able to help and understand and relate to others. It is a great feat. So the outcome, nationally, statewide, and I would say globally, related to social and emotional development, it is to create a resilient child. What is resilience? It is the capacity to recover quickly from difficulties. It's toughness. Things are going to happen, so we want children to receive resiliency support from each domain or system. If you see here, it's arranged, it references domains for communities that care. This uses an ecological systems theory perspective on this slide. So from the individual to the family to the school and the community at large, in OST programs and other environments, we need to know the risk factors. They are what we need to be aware of. And then with regards to adversity and protective factors are the resources and skills that will result in strategies to encourage resilience. So this brings us to the concept of ACEs, Adverse Childhood Experiences. On this slide, you can see the definition and types. The ACEs can be connected to the previously mentioned risk factors. While this is the original list of ACEs, there are experiences not listed here that can have traumatizing effects like natural disasters and community violence. Also, race and poverty are variables acknowledged in later research. Toxic stress is derived from experiences such as ACEs. Responses to toxic stress noted here, fight, freeze, or flight, are accompanied by an intense flow of stress hormones that can affect the brain's architecture and chemistry. Remember what the school-age child is experiencing developmentally, including academic expectations. Therefore, we see here that there is possible neurological, behavioral, cognitive, and psychological effects of toxic stress. Moving on to how trauma impacts youth. So what will they experience, or what will we see in these children? Listed here are some of those characteristics. But the characteristics go from one extreme to another. A child can be withdrawn, want to be left alone, or intentionally and aggressively interact with peers or adults. They can exhibit expressions of sadness, fear, have problems with transition, school, and other environments. And they can exhibit immature behavior and also have psychosomatic issues like frequent stomach aches. And this is just to name a few. These definitely impede the goal of development for the school-ager. So the ACEs study. This research collaboration between the Center for Disease Control and Kaiser Permanente originated from an obesity clinic in San Diego. In 1985, Dr. Vincent Folletti, chief of the Kaiser Permanente's Department of Preventive Medicine in San Diego, California, could not figure out why more than half of the people in his obesity clinic dropped out each year for 5 years straight. His mystery turned into a 25-year quest involving researchers from the Centers for Disease Control and Prevention and over 17,000 people that were part of the Kaiser Permanente's San Diego Care Program, who were mostly white, college-educated, employed adults that agreed to be screened for 10 prominent childhood traumatic experiences as part of their routine health care. The results were, according to Dr. Frank Putnam, the director of the Mayerson Center for Safe and Healthy Children at Cincinnati's Children's Hospital Medical Center, the ACEs inquiry changed the landscape. It changed the landscape because of the pervasiveness of ACEs in the huge number of public health problems expensive public health problems, depression, substance abuse, STDs, cancer, heart disease, chronic lung disease, and diabetes. And I thought it would be best to share this quote to give you some idea of how massive, how huge this study was, to give us some ideas around the effects of adverse childhood experiences. So the expansion of the original research is partly due to the CDC's Behavioral Risk Factor Surveillance System that collects state data about U.S. residents regarding their health-related risk behaviors, chronic health conditions, and use of preventive services for all of our states and the District of Columbia. So as you see here, the original research has been expanded, and even from a legislative point of view, we see a lot of states acting on the individual information they have acquired from their own state's research.
So now we'd like to hear from you again. We'd like to know if your state, territory, or tribe has conducted an ACEs or a behavioral risk factor surveillance system survey. And if so, what department or departments were involved with the execution of the survey? Okay, great, thanks. So, the first question is, has your state, territory, or tribe conducted an ACEs survey, and what departments were involved with the execution of the survey? And we know that some folks are at the state, territory, or tribal government level. We know we have a lot of folks from programs, and I see that somebody says that their district does a survey, which is great, because we know there are also more local surveys happening around school districts. And great, okay, so we've got 19 respondents that say yes. An ACEs survey has been done, and a little bit larger percentage say no. And the departments that are involved are, not surprisingly, a mixture, because this work is so intertwined, and you can see the results yourself, so I won't read through them. Let's see, do people, I see people have quite a lot of comments here. Let's see. One person commented that this is a hard question to answer because it's generally not done across the state. Okay, so I'm assuming that that means that it's done maybe on a district level or a regional level. And that would, of course, be different. So I guess our question could be broader. We were thinking of it more at the level. And then somebody said that it was done specifically with their City Head Start. So a fair amount of people indicated that that their organization has done that, and about the same amount indicated that it hadn't. So that's helpful to hear. Thank you.
So, the evolution of social and emotional learning. According to CASEL, social and emotional learning is the process through which children and adults understand and manage emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. Again, the destination is resilience. There, if you see in the core of this image. So how do we get there? Using strategies that mitigate and prevent ACEs. So positive youth development, which considers the makings of a healthy, productive, and engaged youth to be a combination of their agency, assets, contribution, and their enabling environment. is of initial importance. Then there is having knowledge of ACEs and trauma-informed practices to integrate into our interactions and services with children and families. And lastly, and more recent, the communal concept of the incorporation of healing-centered engagement. So what is trauma-informed practices? As you see here, a program, organization, or system is trauma-informed when it realizes the impact of trauma, very important, recognizes signs and symptoms of trauma in families and stress, integrates knowledge about trauma into policies, procedures, and practices, and number 4, which is very important, seeks actively to resist re-traumatization. This means treating a whole person, taking into account past trauma and the resulting coping mechanisms when attempting to understand behaviors. Therefore, on a larger scale, there is an adoption of policies, procedures, and practices within and across a program, department, system, or a state at large in which staff and leadership are trained and held accountable for the implementation. Principles of trauma-informed care. Now that we have discussed strategies, let's look at the principles of the trauma-informed approach. Here we have SAMHSA, which is the Substance Abuse Mental Health Services Administration, 6 principles that guide a trauma-informed approach. Safety, trustworthiness, and transparency, peer support, collaboration, mutuality, empowerment, voice and choice, cultural, historical, and gender issues. Those are the 6 principles from SAMHSA. Adopting a trauma-informed approach is not accomplished through any single particular technique or checklist. It requires constant attention, caring awareness, sensitivity, and possibly a cultural change at an organizational level. Ongoing internal organizational assessment and quality improvement, as well as engagement with community stakeholders, will help to embed the trauma-informed approach, which can be strengthened with organizational development and practice improvement. An example here. Here's an example of trauma-informed practices shared during the Illinois Afterschool Best Practices webinar. You see here, to maintain structures and routines. So this means it supports consistent expectation. Life should not be a moving target for our children and families. Provide a safe space and belongingness. Be a source of positive regard. Maintain high expectations. Check your assumptions about youth and avoid power struggles. Remember earlier I talked about positive youth development. So know what's going on with children at this time, with youth in terms of their development. Integrate restorative justice. Allow children to explore and explain their actions and resolve their own conflict. And life skills that allow children to learn how to make good decisions and solve problems in their academic and personal lives. And lastly, encourage mindfulness and body movement and ways to self-soothe. These are all great strategies that promote trauma-informed care. Healing-centered engagement. The work of Dr. Jen Wright reveals that while trauma-informed care offers an important lens to support young people who have been harmed and emotionally injured, the families and children we work with are more than their trauma. A healing-centered approach views trauma not simply as an individual isolated experience, but rather highlights the ways in which trauma and healing are experienced collectively. The term healing-centered engagement expands how we think about responses to trauma and offers a more holistic approach to fostering well-being. Healing-centered engagement is strength-based, advances a collective view of healing, and recenters culture as a central feature in well-being. So it really addresses the group. This can start by building empathy, encouraging children to dream and imagine. This is often lost when trauma is experienced. And build critical reflection and take caring action when working with children and their families. Let children talk about it, acknowledge it, along with the families. I will end right here. I want to thank you guys for this opportunity to share. And now this is time for some interactivity.
Thank you so much, Katari, for that great overview of ACEs and various mitigation approaches. That was really helpful. And now we'd like to hear from you again about what resources you have to share about ACEs, trauma-informed practices, or healing-centered engagement for out-of-school time. We know that many of you bring a lot of expertise and resources with you, and we'd love to take a couple of minutes to find out what you can share with us. And we will also share this information with participants when we send out the link to the archive of the webinar. Oh, great. I see in South Dakota there's some Train the Trainer with Enough Abuse. Nadine Burke-Harris' TED Talk on YouTube videos, remarkable. Oh, this is a great one. Boys and Girls Clubs of America's Native Services Unit. Trauma-informed care in early childhood in Indiana. Great. Strong Families, Arizona. Wow, this is fantastic. There's so much information that's being shared that we will definitely include in our follow-up information that we send out. Let's just give people a couple more minutes. Mental health first aid certification. Focus on staff development around trauma-informed care. Identifying resources for staff that experience trauma before implementing programs with students. That's great. That's great to hear about. Educating school system teachers and leadership around the basics. Well, I really appreciate all of the expertise that the folks are sharing and bringing. North Dakota trained over 200 teachers in an 8-hour trauma-sensitive schools curriculum. Okay, fantastic. Thank you so much. Really appreciate the information that you're sharing and the resources and expertise that you bring. I think we'll close this now, and we'll move on to our having Jennifer Drake-Croft present. Jennifer has worked on multiple state and local committees as well as at the state level, and she's helped to lead and shape macro-level initiatives and policies to promote healthy child development, prevent adverse childhood experiences, and support resilient communities. Jennifer.
Hi, can you hear me?
Yes, we can.
Wonderful. I'm glad to hear that. So yeah, I'm really excited to be here today and to talk to you all about Building Strong Brains Tennessee. So the mission of Building Strong Brains Tennessee is to change the culture of our state so that our state's overarching philosophies, policies, programs, and practices for children, youth, and young adults use the latest brain science to prevent and mitigate the impact of adverse childhood experiences. So like many of you, as people begin to understand this science, they begin to understand how we all connect with one another. I mean, this science is often called the Rosetta Stone, and so you have early child care providers connecting to educators, connecting to pediatricians, connecting to the governor, right? And everybody understands what it is that we need to do, align with, and orient to in order to really begin to shift the needle in a positive direction on seemingly complex and intractable issues. So I'm going to go ahead and make sure I can move to the next slide. Hold on one second. Okay. So this is kind of our North Star when we think about the work that we're doing in our state. We are trying to change the philosophy and approach of lots of different individuals in our state. We are working to advance policies and funding to be more effective and to prevent adverse childhood experiences before they occur or early mitigate them before they turn into a really lifelong problematic issue. We are looking to change programs and services in our state. And then lastly, we really want this to get down to professional practice, right? How are people really changing the way in which they are engaging with folks that they provide direct service for? Around these 4 Ps, as we call them, you see all of these different sectors. And so what we know is that if we really want to prevent adverse childhood experiences and promote a foundation for lifelong health, that means that we have to engage every single person. We know this is a public health crisis that we face as a country that's very expensive. And when we think about previous public health approaches, they have done exactly this. So we can often map on smoking cessation, for example, and the work that's been done with that, right? Where we have had lots of different folks come to the table, including individuals like, media, where you would see, PSAs on your television, or you would see previews before your movie started at the movie theater talking about the dangers of smoking. We saw health insurance companies and physicians come on board. We saw schools come on board and educating folks. And we saw every single sector adopt policies and practices that reduced smoking in a variety of contexts, all from you're not allowed to smoke inside of a building or a restaurant to you're not allowed to smoke on a campus. So now, 40, 50 years later, you're able to walk up to any person on the street and say, what are 2 diseases associated with smoking? And they can tell you, right? And that has led to a meaningful decline in a smoking culture. So we know that adverse childhood experiences lead to poorer outcomes than even smoking does, right? Adverse childhood experiences lead to 7 out of 10 of our leading diseases, a host of social and emotional issues, mental health issues, academic failure, you name it, right? There are 40-plus negative outcomes associated with a high ACE score. And actually, having a higher ACE score increases your chances that you'll smoke. And yet, when we go into the community and ask individuals what are 2 diseases associated with adverse childhood experiences, most people, unless they're in our field, they can't tell you that. So that's exactly the type of thing that we are looking to change in Tennessee. So part of that also happens by coordinating a public-private approach, meaning this is not something that can only be solved by government. It is also not something that can only be solved by nonprofits or by the business community, right? We all have to come together and be in alignment in order to change this culture and in order to improve health conditions for children in our state. So, it's been really wonderful to see all of the state agencies think about how they can get in a room and align and change the way that they do business. So I'm going to talk a little bit about, kind of how Building Strong Brains got started and how it really, we've benefited from such great public and political will. We had our commissioner at the time of the Department of Children's Services, here Dr. Vince Fawidi and here Dr. Robin Carr-Morse in Memphis talk about adverse childhood experiences. And that exposure, it's just like many of us, the light bulb went off, right? And he said, we have got to start investing in those common sense policy solutions and practices that are going to prevent these outcomes that result from adverse childhood experiences, including, the billions of dollars that we spend not only in child welfare issues, but also in healthcare issues and crime and those sorts of things. And so he came back and said, let's look at some communities that are already doing some early work like Memphis and Nashville. Let's bring them together and let's have a statewide approach. And so the priority was really we have to have a common message and we have to have evidence-based communication in order to get everyone to care about this issue. So to our benefit, he was then appointed deputy governor. And shortly after he was appointed deputy governor, we had a massive summit where we invited not only, the usual suspects of folks that are in education and state government and in nonprofit, but also we had legislators present. We had half of the governor's cabinet present for all of the child-serving departments that serve children and families. And we had the governor, the first lady, and the deputy governor there. And we spent the day really focused on not only brain development, but also communication science. How do we use communication science to advance public understanding? And so after that, our deputy governor then decided we need to appoint 2 people from every state department that touches children and families, and they need to be in a decision-making capacity, and they need to be figuring out, like, how are we going to change our policies and practices to improve conditions for children. So I can't read through every single thing on each of these slides, which is why I'm glad they're going to be available for download. And if you have any questions, please reach out to me. I'm happy to direct you to more information. But I wanted to just kind of highlight some of the things that this audience might find more useful in terms of what's being done in the public and private sector. So what you see here is when we think about education, our Department of Education, they actually took a Training for Trainers curriculum that we developed here at the Tennessee Commission on Children and Youth with help from the National Scientific Council on the Developing Child and with help from the Frameworks Institute. They took that and then added in some additional modules about those policy strategies and practice strategies that need to happen in schools and the classrooms to help them respond to ACEs and become trauma-informed. So they actually ended up reaching, it says 5,000 educators. It was actually over 7,000 educators and school administrators across the state. And then they decided, what do we need to do next? Well, now we really need to provide technical assistance to schools to adopt these practices and really make meaningful changes. They had an overwhelming response of 150 schools who wanted to receive this technical assistance, despite the fact that it didn't come with any dollars, right? And so they were able to select 72 schools for their first cohort, and we have already seen from some of the school systems that have adopted these practices meaningful shifts in a decrease in absenteeism or truancy, a decrease in exclusionary discipline practices, and even office referrals in general. So we know that that's going to translate to better academics over time. When we look at our Department of Human Services, which oversees our licensing for early child care facilities, they're requiring that every single child care facility that's licensed receive training and adverse childhood experiences every 5 years, right? So that includes everybody from the director all the way down to, the staff that staff the child care facility, and of course, early childhood educators. And we even have our Office of Criminal Justice Programs involved, and they are just really doing some great work with expanding our a Handle with Care initiative that was born out of West Virginia, where every time a child or youth is exposed to a crime or an incident that would warrant police involvement, that the police officer then calls a school liaison, and that liaison then reaches out to the child's school, does not tell them any details, but says, we need to handle this child with care. And so when that child comes in the next day, they're received by their school home with that kind of care and attention, and not a misunderstanding of maybe negative behaviors or with symptoms of withdrawal. And instead they're supported. So these are just a few examples of things that have happened in the public sector, in government, and it's been really exciting, and we're just seeing such great traction in state government, which people say is a little bit unusual, right? So typically what we've heard from other states is that folks are fairly siloed, and that they don't see this kind of cohesion among different departments. So right now we are working on also training our insurance or managed care organizations through our Medicaid organization, which is TennCare. And so it's been great because they're going to be the folks that help us figure out how to create reimbursement for services that would be more preventive in nature and would help us really get at the root causes of ACEs. And then I'm with Tennessee Commission on Children and Youth, and I mentioned that we have this wonderful Training for Trainers initiative. Thus far, we have trained over 950 diverse sector individuals across our state, and those individuals have reported reaching over 39,000. It's actually over 40,000 at this point, additional people through their presentations. So moving on really quickly, you can see that through our Training for Trainers initiative, we've sought to saturate our state. So we know that in our 67 out of our 95 counties, trainings have been conducted. And then what you see at the bottom there is that participants from all but 2 counties in our state have received a Building Strong Brains training. So in terms of our private sector work groups, I talked to you about our public sector work group and the changes they're making. We have this private sector work group that's largely made up of those managed care organizations, of trade associations, of organizations like Rotary clubs and Kiwanis clubs, of large statewide nonprofits focused on this issue, and philanthropy, right? So we have lots of folks at the table that are also thinking about how they can create change in the community and influence based on their reach and their ability to lead. And so some of the things that you see is that we have this sort of adoption of these principles, values, and this common language that we use that is developed by the Frameworks Institute that really serves as an extender into the community. We see that there are expectations from philanthropy, that grantees that they're granting money to have a plan to address ACEs and embark on trauma-informed practices and strategies. We see a wider spread implementation of our Building Building Strong Brains related trainings. We see an increase in uptick of collective impact strategies used across the state to address these issues in using a public health or collective impact model. And then we have a wonderful nonpartisan public policy think tank in Tennessee called the Sycamore Institute, and they recently released a report that demonstrated the economic cost to Tennessee, based on several indicators of ACEs. So they found that just based on a few indicators that the economic impact on Tennessee is $5.2 billion per year. So that not only got the attention of a lot of policymakers in our state, but it also got the attention of folks nationally outside of our state. And so one other thing that I want to highlight that's been a real success from our previous governor, we just got a new governor, but our previous governor ended up just being able to speak beautifully about this topic extemporaneously without prompts, and the First Lady also was such a huge supporter, and they really put their money where their mouth was. So in fiscal year 2017, they appropriated $1.25 million to ACES Innovation Grants. And then after that it was appropriated another year, and then as he was beginning to exit his second term, he actually increased that appropriation to $2.45 million and put it in recurring funds, meaning that it will, we won't have to advocate for it on an annual basis. It will be there until the legislature or somebody proactively decides to stop that. But honestly, the legislature has passed that, budget every year, which shows their endorsement and support, and we have real advocates in our Tennessee General Assembly around addressing adverse childhood experiences. So I don't expect that it'll go away anytime soon. The innovations that have come out of this, our goal when we were thinking about distributing these funds was to make it widespread, so not just concentrated in urban areas with lots of resources, but an equal distribution among the three grand divisions of Tennessee, East, Middle, and West, and also in both rural and urban communities. And then also we wanted to make sure that these innovations were touching many different sectors, as you can see here. And so there are far too many, though I would love to talk about all of the ACES Innovation Grants and the outcomes they're seeing. I want to just touch on a few that might be better related to this audience. So in the community there, you see the Boys and Girls Club of Knoxville. There are also other Boys and Girls Clubs and mentor programs and those sorts of things that touch children and youth that have been funded, and especially during after-school hours and during the summer. And a lot of those proposals focused on ensuring that all of their staff were trained in ACES science and in trauma-informed practices so that they could be better, they could be more responsive to the children and youth that they work with. Another program that I want to kind of point out is that there was something called Discover Together Grundy, or Grundy County Discover Together, which you see there under the community. And what they really looked at was the fact that, that absenteeism or truancy is often an indicator that lets us know that something's going on in a home and that a child and a family may need support. And so they really have knitted together in a meaningful way a lot of community advocates to connect with families and connect them with resources and knowledge about child development and about, addressing the needs that they're struggling with as a family. And they have partnered with the Yale Child Studies Center to make that happen, and they have seen a significant decline in truancy and absenteeism, which we know disproportionately affects children who are experiencing poverty, and that county is a pretty impoverished county. So they've seen pretty amazing outcomes just by empowering the community and leveraging those connections. But you can see again that we are really really changing the landscape in academia, child welfare, early childhood education and child care, and the community. Also in K through 12 education, juvenile courts, the media, the faith-based community, and medical providers. Most frequently, we've seen hospitals, the chief medical officers of children's hospitals get very involved in this work. So moving on, you can see again that we have this sort of saturation that we have promoted, where we've wanted to make sure that many counties across our state are getting the benefit of this science knowledge and these innovation dollars. So just to kind of begin to wrap up, we had another summit that happened on September 11th of 2018, where we had lots of national speakers come and present and really think about, okay, we have begun to generate awareness. Where are we going next? And how do we think about ACEs in a more holistic way when we even think about housing issues, transportation issues, stormwater management issues, et cetera. And it was a really empowering summit. Moving forward, we're really thinking about sustainability and ensuring that our policymakers, we had a 30% turnover in our legislature this year, and so we want to make sure that new policymakers, legislators, et cetera, also understand this remarkable work, the science, and continue to shepherd it through and improve conditions in our state. So when we think about our vision of success, when we did our strategic planning, we're thinking about universal awareness, making sure that we have competent, committed, and inspirational leaders at every level. That doesn't just include state government, that includes local government, and even those unexpected leaders. We want to see broad community engagement in this, common practice implementation. We want to see that we have some shared data points because we want to know that what we're doing is working. Right now we have one data set that or data point that we are looking at in terms of general awareness that is being conducted by the University of Tennessee. But again, we know that there's a lot of power in data and understanding what's effective and what's not. We're wanting system-specific marketing strategies, more business engagement and advocacy and investment, and then formalized infrastructure support. Because while it's been lovely that this has been owned by no one, that also means that because it belongs to everyone, that we need to have some level of accountability and formalized infrastructure support. So when we look at our strategic priorities, we're really looking at engaging folks and equipping people and communities with tools and trainings, connecting people to learning and information, and then supporting them with financial models, marketing, and infrastructure as they work to change the culture in their respective communities. And so these are kind of some of the strategies. I'm not going to go through them all because I'm running out of time. But again, I would be happy to connect with you individually. A big component of our work has been knowledge mobilization, and so through knowledge mobilization teams, we're encouraging communities to think about what they can do at the community level. And then Siobhan is actually telling me I have a little time, so I'll slow down a little bit. Okay, so I'll go back to that other slide actually, just to dig in a little bit deeper since we're not rushed. We're going to really work on sustaining our efforts by enhancing effective strategies that increase public awareness and action. So what we notice is that similar to all of us as professionals, this information, this science is very intuitive, and it lights people on fire, and they have hope again, right? They have hope that the things that they've been struggling with in their communities, that those things can be addressed through these innovative solutions. And so having that sort of grassroots and constituent leadership not only is going to be what mobilizes and really changes conditions in communities, but also what keeps, elected officials interested. Again, we want to support the extension of scientific and practical learnings through learning communities. So, we have all these ACES innovation grants, and they're wonderful, and innovation is powerful. But we want to make sure that it doesn't just get that it doesn't get kind of holed up in a report somewhere, only used by one organization. So we're really looking at, if you're seeing movement and change, how do we share that with others in your field, both locally and nationally, right? We care about all children, and so we're exploring that right now. How do we do that in a way that won't overextend our capacity? We want to be good stewards of the generous appropriations we have received from our state governments, right? We want to show our legislators and our elected leaders that they have made a wise investment by thinking about innovation and by preventing trauma. We want to cultivate those 2- and 3-generation approaches to community solutions, and that's something that formally in state government is really supported by Department of Human Services, but is also being supported in a less formal fashion among many child-serving and family-serving agencies throughout our state, as they understand that we can't improve child conditions if we are not improving if we're not supporting the adults that are raising them or caring for them or teaching them, right? We continue to seek input from our stakeholders. So this is not these decisions that we are making, this process that we're undergoing is very much in touch with the needs of local communities and what they're seeing. And we have this very nice bidirectional communication that goes from the local level to the state level and back. And also, we are working to engage the business community to recognize that the investment in children today is an investment in their workforce tomorrow, so that it is in their best interest as well as the best interest of the community to invest in these sorts of things. Okay, so let's move on here. So our 2 areas of focus when we're thinking about our upcoming administration of funds that we have for this fiscal year, ignore the thing about proposals, but because they're already done and we've already reviewed them, we're about to let folks know if they were awarded an ACES Innovation Grant. But our 2 areas of focus are really child development interventions and direct services to children, youth, and young adults and their caretakers, and also what are those community conditions that are or may contribute to adverse childhood experiences. So again, just trying to push the envelope further when we think about progressing this work and really changing culture and systems and making sure that it's embedded. So our overarching effort, if we had to put it into just one slide, right, would be this, that we are working to change our culture by using our collective ability to move from the question, what's wrong with this child, to what has happened to this child, and how do we wrap services and supports around that child in order to effectively intervene, support them, and support the development of lifelong learning, good, healthy behavior and healthy mental health and physical health, right? Because we want every child to not just survive, but to thrive. So, I would take a step further, that it's not even at an individual level with a child. It's about everybody that we interact with in our community, that we begin to think differently in an open and more curious way. Tennessee, like many states that are represented here on this webinar, we have an opioid problem, among other substance abuse problems, but the epidemic is has hit Tennessee pretty hard. And so again, when we think about things like that epidemic, we want to think about like instead of what's wrong with these parents or these individuals that would abuse substances, right? We want to think about what has happened to huge portions of people in our state that have led to this increase in substance abuse, particularly opioids, in order to cope with their stress. And very recently there was a report released by Vanderbilt University that spoke to just that. It said the opioid epidemic, that there's almost a perfect overlay if you look at the map with those conditions of lack of employment opportunities and lack of substance abuse and treatment, mental health treatment facilities. And so again, it is about what happened to these communities where we're seeing this uptake or uptick in substance use. So moving on. I want to just say thank you so much for my time here today, and I'm glad I got a few extra minutes to chat. But I would love to turn it back over to Siobhan and ask if there are any questions that I can answer.
Well, thank you so much, Jennifer. It was so wonderful to hear about the cross-sector work that's been happening in Tennessee and all of the different parties that have been involved. I was really struck by the breadth of engagement across the state that you communicated really well, and also the messaging to the different types of organizations, right? So tying it to, tying ACEs and social emotional learning to workforce development, to reducing juvenile justice problems. So really making the connections for the different organizations to bring everybody in. And I loved the way that you closed with, instead of what is wrong with this child, what has happened to this child. And actually one comment that came in, which was really interesting, is that even a slightly different way of phrasing it, which is, what have this child's experiences been, which I thought was kind of interesting to broaden that. So that was one comment that came in, and we do have some questions. So I would love to share some of those with you. I think you covered some of these, but I just want to make sure because they were coming in fast and furious while you were talking. So the first question was about funding to implement these changes, and I think I heard you say that not necessarily at the beginning, but then farther along in the process. Can you just talk a little bit about the funding?
I absolutely can. So, yeah, funding has come from a couple different places that honestly I'm glad I get to expound upon. So the ACES Innovation dollars would be our largest source of funding, and those are state dollars. So that was an appropriation by our governor, and then it was put in his budget, and then it was approved by our General Assembly or our state legislature. And so that's how we have had all of those innovations funded. However, there are some other ways that we have funded the good work that's happened across our state. One is that by engaging philanthropy early and engaging them often and helping them understand that many of the things that they fund stem from childhood trauma and ACEs, we saw that their strategic priorities shifted a bit or maybe became enhanced. And then as a result, there's been more things funded at a local level across the state, in local communities that are working to address and mitigate ACEs. Another thing that I would love to see other states do is when there are extra dollars that are unspent from federal grants, because ACEs connect to so many different things, it's often easy to, instead of returning those dollars, right, or printing a bunch of coloring sheets or whatever you might do, to think about how you can invest in your strategic priorities in addressing ACEs. So a perfect example would be like our Department of Health. They had some unexpended dollars. They said, could you use this for Building Strong Brains? And we already have a wish list of things that we would like to accomplish with Building Strong Brains. So we said yes. And we ended up producing a ton of materials that are like bookmarks, flyers, et cetera, which almost sounds like coloring sheets, but they've actually been incredibly useful for widespread dissemination. And I've even seen things on social media of people that I don't even know through work saying, look at this awesome material I got, right, that helps me understand these concepts a little bit better. So, I mean, I think that, you know, alignment, they also oversaw our strategic planning work. So, so those dollars supported that. So you can see how, you know, you can sort of bring in lots of different pots of money to support innovative practice and strategy.
Great. Thanks so much. We do have a couple other questions. One is, can you share any evaluation process or findings that you've had, or how are you evaluating this work? Because it's obviously a big effort, and I'm sure you want to measure what's working.
Absolutely. So, so this is honestly a little bit of our Achilles heel when we think about the global work that we're doing. And any of you that are familiar with, like, you know, public health work or innovation in general, but especially things at the population level, it's a little bit trickier to measure and monitor your success. So what we've done so far is we have connected with the Social Work Office of Research and I think it's Public Service, which is out of University of Tennessee. And what they've done is they've gauged a couple years ago what was the awareness around adverse childhood experiences among the general public in our state, and we're about to have a second you know, study conducted by them to see have we moved the needle on general awareness. Now, when it comes to your other projects, like more specific projects that have been funded by the ACES Innovation Dollars, they all have their own specific outcomes. So I talked a little bit about the schools that are using the trauma-informed policies and practices and the decrease that they have seen among, you know, office referrals, attendance issues, and exclusionary discipline practices, right? So each one of the innovation grants has its own measurements, its own tools that it's reporting back on. You know, for Belmont, which is one of our universities in Nashville, where they have integrated this knowledge into the College of Health Sciences for every nurse, person receiving a public health degree, social worker, and like physical and occupational therapists, all of those degrees under that college. What they're really looking at is how do we measure this in our competencies, right? So it's just going to be different from activity to activity. And then because we know that ACEs impact long-term health, it is our hope that we will begin to see the needle shift on our kids count data, right? It's always 2 years behind in almost every state, but we would want to see that over time that child well-being and health and all of those indicators that we measure as a state begin to improve.
Great, thank you. I have one more question that came in and one suggestion. So I'll just pass along the suggestion. Somebody asked if the Tennessee chapter of the American Academy of Pediatrics is involved in this initiative, and if not, it might be good to reach out to them. And I can send you that in the email too if you're not connected with those folks.
We are. So our TNAP chapter is very involved, and they're on our private sector work group, which is awesome.
Oh, excellent.
They've already done a lot of work with our pediatricians across the state.
Okay, great. Check that off. And I think you addressed this as near when you were wrapping up, when you said that something like, it's great that nobody's in charge of this, but it's difficult that nobody's in charge of this. There was a question asking if somebody was responsible for coordinating all of this activity. And I think it might be you,
No.
but I'm wondering if you could just if you can address that a little bit. I'm sure it's sort of complicated, but I was really interested to know that as well.
Yes. So actually we have a Building Strong Brains coordinating team. And so that coordinating team are really the most invested individuals in this work. So they kind of oversee and direct the work of the public and private sector steering groups. And so the folks that sit on that steering committee are actually Mary Rolando, who is the ACES Innovations Director for the Department of Children's Services. They are the actual department that disperses the funds, though we all, most of us read the grant applications and have some consensus about who gets funded. Another person would be our Section Chief of Early Childhood with our Department of Health. We, of course, have representatives from the Tennessee Commission on Children and Youth there present. We have somebody from the Department of Education, and then we have ACE Awareness Foundation's Executive Director out of Memphis, and then we have our somebody from a Council for a Stronger America present, or Ready Nation, and then our two co-chairs of our private sector work group. So all of those folks really make up. Oh, and I neglected to mention Jude White, who is one of the deputy commissioners at the Department of Human Services. So all of those folks, they almost sound like the public sector work group. The public sector work group is much larger, believe it or not. It's about 30 or 40 people. But those people are really the ones that meet. They meet every week and think about what we need to do, what's next, and take ownership of the work.
Well, thank you so much, Jennifer, for sharing this work. And it sounds like you've got an amazing team working on it. And I know this is a lot of food for thought about how others might implement some similar initiatives. And I know that a lot of our participants on the call are very actively involved in either state or local initiatives. It's really exciting to hear about the work that you've done and what your plans are and all of the collaboration that's happening. So thank you so much for sharing that and appreciate those great questions. I just want to remind you as we wrap up of the research brief on this topic. And thank you very much for joining us. I'd also like to thank Heidi Ham and Jennifer Drake Croft so much for presenting today and sharing the work that you're doing.